Good afternoon, everyone. Thank you for joining us today for the latest update on the COVID-19 national emergency and state emergency. Again, I'm delighted to be joined by Secretary Dr. Nate Smith, who will give a report a little bit later. First, I want to express, on behalf of all of Arkansas, the concern for the residents of Jonesboro and northeast Arkansas that suffered the tornado hit last night with incredible damage. We're grateful that there was not been any reported loss of life yet, but I will be leaving shortly after this to go to Jonesboro and to meet with the local officials and also see firsthand the damage that was done to the businesses and to give them confidence that we are working with local officials to have federal emergency support in place. I have just now signed the declaration, the proclamation declaring the Jonesboro area as a result of this tornado strike a disaster area that will help to speed up resources to them. In conjunction with that, with the fact that we're under one emergency because of the COVID-19 urgency and virus, and then the tornado strike, it certainly is a tough time for Arkansans, and it was appropriate that, as I mentioned yesterday, today was declared as a day of prayer for the people of Arkansas, and I've been encouraged by so many people of faith, our churches, our synagogues, and others that have been in prayer for our state and our nation during this challenging time. And while we work hard, we try to act every day, we encourage responsibility, we also recognize our own limitations and the need of providential protection. Yesterday, I reported that we had 404 cases of COVID-19 with 48 hospitalized. Today there are 426 with 43 hospitalized. And Dr. Smith, of course, will comment on this more specifically, but in our conversations that while it's too early to know for sure, but we are encouraged that we are not accelerating as fast as some other parts of the country. Now, obviously, you have the hot spots from New York to New Orleans, but even in other parts, the anticipated acceleration rate puts us on a very fast curve upward, and we're hoping that the fact that our acceleration rate is not at that high of a level is a good sign for us, and most importantly, an indication that our social distancing, our discipline, our limitation on gatherings is having an impact. And so we're on the right strategy. We just have to keep the course, not quit on this, and work hard on this every day. I do also need to report that there's an additional death, and so our deaths as a result of COVID-19 is up to 6. I want to give thanks for some of our Arkansas partners and others that have really worked hard with us on the logistics of getting our personal protection equipment here. These are all overseas shipments. That's not easy in this environment to have the products produced, to have the mask made, the gowns made, the gloves made, and then to get them to the port, to get them on a plane or a ship, and to get them here where we can put them in the needs of our responders and healthcare workers. I want to applaud J.B. Hunt Trucking and FedEx Freight for their hard work in helping us to move this ball forward and get the plans laid to get these products back home here to Arkansas. And I've been on the phone with them today and yesterday trying to accelerate that, and I appreciate very much their cooperation. With that, I want to give the microphone over to Dr. Nate Smith.
Thank you, Governor. This is a difficult time, obviously, with both the tornado and the COVID-19 outbreak at the same time. I want to give some more detailed breakdown on some of our numbers. As the Governor has already mentioned, we are at 426 cases total, no new counties. The gender breakdown is about the same. It's still that 60% women. The number of children so far is 15. The number of Arkansans age 65 and older is 135, with 276 adults aged 18 through 64. I want to give a little bit more detail again about other conditions. We have, of our total of 426, we have 6 pregnant women. That's 1 more than yesterday. We have 36 with diabetes. That's 4 more than yesterday. 32 with heart disease. That's 3 more than yesterday. 21 with chronic lung disease, which is 2 more than yesterday. And 10 with chronic kidney disease, which is 1 more than yesterday. We still have 11 with immunocompromising conditions. Of the 426, 69 have been related to domestic travel. We have, as the governor mentioned, 43 hospitalized. That's 5 less than we reported yesterday. That's a good thing. We have 43 in nursing homes. That's 1 more than yesterday. 16 currently on a ventilator, and that's 1 less than yesterday. As the governor mentioned, we do have an additional death, so we have a total of 6 deaths. The additional death was someone age greater than age 65 who passed away at home. We have 28 who have recovered. That's 4 more than we reported yesterday. Of our 426, 67 are healthcare workers, and I want to just highlight that our healthcare workers, doctors, nurses, but the whole medical team, from clerks to medical assistants to respiratory therapists and all the others, they are putting themselves at risk when they care for patients because not everyone who's infected with COVID-19 knows that when they come into the healthcare setting. And so the governor's declared this as a day of prayer for COVID-19, the COVID-19 situation. I'd encourage you to remember our healthcare workers and the work they're doing. My wife is a physician. She's an obstetrician gynecologist, and she'll be going back to work on Monday. And although pregnant women are not our highest risk group, all of our healthcare workers are serving sacrificially, so we need to remember them. The governor mentioned the tornado. That's a challenge. We got a call last night. How do you set up a shelter in the setting of a COVID-19 epidemic? And so our Dr. Tomlinson, who was on call, and Greg Brown, our incident commander, sent out some guidance for shelters, how to do that safely. So these are challenging times. And the last thing I want to mention is this issue of social distancing. I've talked previously about funerals and about weddings. Another place where I see a lot of folks gathering together is at the grocery store. Now, we all need food. We need to buy food, but I want people to be mindful about when they go to the grocery store. We don't need all to go at the same time, and when you go, we don't all need to be crowded together. Spacing out those lines, maintaining that 6-foot distance, so that we do what we need to do, but in a way that doesn't put us at unnecessary risk for COVID-19. And I am encouraged by what the governor shared about our numbers have not taken off exponentially. We're going to watch that carefully. I'm encouraged that we have not had an increase in the number of hospitalizations over the last day, but let's keep doing what we're doing so we protect ourselves and our communities, and hopefully not have an explosive situation like we've seen in some other states. And thank you very much.
With that, we'll take questions. Yes.
If you had the authority, what would you do to get more reagents, more supplies, so that the testing could all come together and actually increase, you know, more reagents, so that there wouldn't be a pause?
Well, I mean, if I had, I would move Arkansas up in the priority. We're doing all we can to move us up in the priority, but these decisions are made largely by the private sector, perhaps with some guidance from CDC as to the hotspot areas that they need to prioritize. But we're doing what every state is doing, which is both on PPE, but also on the reagents that we need. We're waiting in line, and we're pushing multiple different sources. And so that's one of the reasons I've reached out to different people in the private sector that can help us with the access to the reagents and the supplies that we need for the testing. I hope to have some good news to announce tomorrow in regard to the testing, so stay tuned. But we're scrambling. The federal government is a good partner, and they have given us supplies. They have supported us in what we're doing, but they've made it very clear that it's up to the states to do their own procurement on this, and so that's what we're working on. I am pleased that they, when it came to ventilators, have invoked the National Production Act, the Defense Production Act, so that we can have some confidence that the supply chain will increase over the long term. And when you look at Arkansas, while we know that we're going to need more ventilators and we've ordered more ventilators, we do believe we have some time to work with because of our low rate of acceleration. So if we're reducing the height of the curve, if we're extending that out, we're having success because the supply chain will catch up with our needs. The biggest challenge is testing because, as Dr. Smith says, we need data. We want more data in Arkansas, and the testing is what gives us the data. And so that's the immediate need, as well as protecting our healthcare workers. And so we concentrate on that. That's really a supply chain issue that our whole team is working on, including Adam, myself, UAMS, and the Department of Health team. But that's, hopefully we'll have some good news in the coming days on that. Yes, ma'am.
So we know that Louisiana is a really big hot spot for growing cases of coronavirus, and that's been traced back to Mardi Gras. And since, you know, Louisiana borders Arkansas, can you react, you know, are Arkansans at risk? Do you have any advice for any Arkansans that might have been at Arkansas?
Well, if you go down to New Orleans and you come back to Arkansas, as Dr. Smith said yesterday, I hope you'll self-quarantine for 14 days. Now, the president has actually said that in reference to some of the hot spots in the Northeast, and we recognize that there is a supply chain. You've got to deliver critical supplies, things like that. But we're talking about those that are traveling more casually. If you go into these hot spots, you want to come back to Arkansas, self-quarantine for 14 days. That's not helpful for us. It puts the entire state at risk. And I'm sure Dr. Smith wants to elaborate on that.
Yes, I would like to point out that New Orleans and the surrounding parishes are a hot spot, but that's not necessarily true for the entire state. The risk of COVID-19 in northern Louisiana, for example, is from the maps that are out there, it doesn't look like it's that much different than southern Arkansas, and there are people who cross the border every day, you know, either for work or to seek medical care or whatever. And so we don't want to make a general statement about the entire state when we know the hot spot is really in the New Orleans area.
Yes, sir.
You were mentioning a little bit earlier about the challenges that I guess Jonesboro specifically will face trying to set up a shelter with these COVID cases. Can you give a little more specific on what those guidelines entail?
Certainly. Part of it is screening people who enter, asking about their recent travel history, symptoms, doing temperature checks, and also making sure that we have a place to segregate those who may be at risk for COVID-19 from others. From what I understand, we haven't had very many folks going into those shelters at this time, but having that set up in place from the very beginning is important.
Yes, ma'am.
So, in the case of families, when one person has been tested and other people in the family show symptoms, are we testing them all, or are there presumed cases of COVID that don't fall into the confirmed cases? And would that give us a bigger picture of infection?
Yeah, certainly if there's someone who's been exposed in a family or household setting to someone with known COVID-19 and they develop symptoms, we will presume that they are positive as well. Ideally, we'd like to get all those individuals tested, but until we get test results back or until we have the opportunity to test them, we would of course consider them a presumed case. We don't report those out. Those would sort of skew our numbers and make it difficult to compare nationally and internationally, but certainly from a practical standpoint, we would consider those presumed cases.
I saw that there weren't monitoring numbers. Are you still I mean, I didn't see them on the website. Do you still have a number of patients that you at the health department are monitoring?
Absolutely, we do. We have focused our monitoring, though, on the highest risk situations, the settings, healthcare settings like hospitals, long-term care facilities, healthcare workers, and closed congregate living settings. For example, if there was a case in a jail or prison, that would be our focus. We want to make sure that we're focusing our energies in the areas where they can make the greatest impact. Otherwise, we can end up using our resources on things that are not going to get us the most bang for our buck.
So that would include like contacts of known cases?
Contacts of known cases are also really high priority, of course. We do have a electronic system set up so that people can report in on a daily basis, and we continue to use that.
You said the additional death for a day was a case where a patient passed away at home. Was this a known case, or was this something you got discovered afterwards?
Yes, this is a known case, actually someone who had been hospitalized and seemed to be getting better. And unfortunately, there are many things that are challenging in caring for a new disease where our clinicians don't have years of experience. They do their best, but sometimes people can seem to be getting better, and then they can take a turn for the worst.
Yes, ma'am.
So out of those that are they dying of pneumonia or other complications related to COVID-19?
Our deaths so far have been, presumed to be respiratory. We do know from cases around the world that a certain proportion of COVID-19 patients who develop severe disease can also have heart involvement. It can be difficult to tell between just lung or someone who's having disease that's involving both the lungs and the heart. So it's not always possible to completely sort that out, but the clinicians who are caring for these patients are looking out for both.
Dr. Fauci today predicted anywhere from 100,000 to 200,000 infections, and so at what point does Arkansas decide to shelter in place? Do you have like a number, an equation, idea?
No, we don't have a specific number as a trigger. I think we're going to have to look at a lot of different things in terms of our strategies. One is that whatever we do, we need to be able to sustain it for as long as we need it. And the changes that we put in place, although they're very difficult, very painful for many Arkansans, they are things that we can sustain, I think, as long as we need to sustain them. We'll also need to look at how effective the sheltering in place strategy is. So far, if you look at the places that have chosen to shelter in place, although in theory it seems like it ought to help, their growth of new infections are actually faster than ours in many of those places. So I would like to see some evidence that that strategy actually does more good than harm. And then, of course, it's a dynamic. It's not just the numbers; it's the rate of growth and other factors that would need to be considered for changing those strategies.
One last question. Yes, sir.
You mentioned a little bit earlier about grocery stores being somewhere you need to practice social distancing. Sort of how would you suggest to make that feasible, since a lot of people do shopping like right when they get off work or things like that?
I've got some specific suggestions, so I'm glad you asked that question. One is, who does the shopping for you? I found out that my 80-year-old mother was going to the grocery store to go shopping. Now, fortunately, she saw a crowd, turned around, and went home. But you don't need to send your 80-year-old grandmother out to do the shopping these days. Send the grandson who's 18 years old with a list. He can do that. Second is try and choose times as much as you can that are slower. Not everyone has to go together on a Saturday morning. And then third, when you get there, let's space it out for lines. I know that some of the grocery stores around the country have actually instituted policies where they have the lines with 6 feet in between people. Now, what I wouldn't want to happen is everyone shows up in the parking lot and then they crowd together while they're waiting to get into the line. But we just need to think through it and make sure that we don't have to stand right next to each other the way we usually do. And if you show up and the parking lot is full and you have the option of coming back in another time, then that might be a good idea.
What about your 68-year-old mother?
Well, I think I would, see if there's someone younger who could help out with that. And then you don't have to go, maybe 5 times a week. Maybe just get your list and go once.
Thank you very much today.